Hello there. Thank you and welcome to the Philadelphia Department of Public Health's presentation on overcoming disparities in clients' access to HIV prevention resources. My name is Geraldo Ayola, and I am the HIV Prevention Outreach Specialist here at Ambulatory Health Services. Ambulatory Health Services covers 8 city health centers where we aid and support individuals who live in Philadelphia who are low income, underinsured, or have no insurance, and we help link them to HIV prevention resources. The learning objective for this e-module is to help identify when clients may benefit from HIV prevention resources. Why is this e-module relevant to caseworkers and frontline staff who serve families with young children? It equips staff with knowledge to educate families about HIV prevention, early intervention. Staff can identify and address risks early, ensuring better health outcomes. Community health. It enables staff to contribute to the overall health and well-being of the community by preventing the spread of HIV, and support for affected families, which staff can provide informed support to families affected by HIV. Now let's go over the agenda. We're going to talk about the impact of HIV on Philadelphia residents. We will talk about what clients can do to keep themselves protected against HIV. We're going to talk about how you can help clients stay protected against HIV and who is eligible for our services at our city health centers. Impact of HIV on Philadelphia residents. Philadelphia is one of the cities in the state with the highest rates of new HIV diagnosis. In 2022, Philadelphia was rated number 6 for new HIV infection rates, and in 2023, Philadelphia was rated number 19 in overall HIV prevalence. A takeaway from this slide is that from 2017, we started seeing a slight downtrend in new cases and a dip in 2020, but as you can see on the chart, it starts to increase overall. In 2022, Philadelphia has diagnosed more people living with HIV than in 2021. We still have a lot more work to do to reach our EHE goal. Now we will go over what clients can use to keep themselves protected from the HIV virus. Let's start with condoms. Condoms form a barrier that viruses and bacteria cannot effectively pass through. Condoms prevent bodily fluids that contain active HIV from entering a person. The effectiveness of condoms also depends on the correct and proper application. It's important to note that while condoms significantly reduce the risk of HIV transmission, they do not eliminate it completely. Therefore, they should be used in combination with other preventative measures, such as regular testing for HIV and other STIs, and considering pre-exposure prophylaxis or PrEP if appropriate. PrEP, or pre-exposure prophylaxis, is intended for people who are not living with HIV. PrEP is a pill you can take every day to reduce getting the chances of HIV up to 99% if taken as prescribed. It is by prescription only, and it does not protect against other sexually transmitted infections. Condoms are still recommended. Most people are eligible and should not have to pay anything for their prescriptions. Now let's talk about NPEP, or post-exposure prophylaxis. NPEP must be started within 72 hours of the most recent possible exposure to HIV. It's important to note the 72-hour baseline, and it's a very important question to ask clients when was their last sexual encounter. Asking clients when their last sexual encounter was, down to the last minute if possible, is essential to gauge how much time is left for the client to get NPEP and for it to be most effective. Now let's talk about treatment as prevention. Treatment as prevention is for people who are living with HIV. They can take medications called antiretrovirals. Antiretroviral medications can help people, again, who are living with HIV, achieve a viral load suppression when taken as prescribed, meaning that their cells are halted from producing HIV. This is also called U equals U. U equals U is a term that we use to identify people with HIV who have a very low viral load, meaning the number of virus in their body is really small and cannot be detected by tests. Essentially, these folks cannot transmit the virus if they have unprotected sex with another person not living with HIV. Now that you have all this awesome information, how can you help now that we know all this? Caseworkers, caretakers, and other public health figures can recommend these strategies for folks who may be at risk for HIV. The HIV prevention team at Ambulatory Health Services are equipped to help clients navigate strategies, and it is important to refer them over to our team so we can educate them on best strategies. Some risk reduction strategies are condom negotiation strategies and how to use condoms properly so they do not break, getting tested regularly for HIV and STIs, choosing less risky behaviors like frauding or masturbation, taking medicine to prevent or treat HIV like PrEP, PEP, and antiretrovirals, reducing the number of sexual partners, and using harm reduction services for people who use intravenous injection equipment. The information on this slide is for our HIV rapid screenings only, not primary health care services like PrEP and MPEP. Eligibility for HIV rapid screenings at our city health centers is for anyone who is 13 years of age or older, for anyone with a recent or perceived risk. This is important when looking through a client's chart and noting they're having sex, condomless sex, and or sharing intravenous needles. Here are some important points to keep in mind. Clients do not need any insurance to access our HIV prevention services. There is also no city residency required for HIV screenings at our health centers. Non-Philadelphia residents can access prevention services like PrEP and MPEP through Health Center Number 1. Now let's go over what HIV prevention resources are available at our city health centers. We offer free confidential HIV and STI screenings, walk-in services for HIV screenings only, PrEP and MPEP services for HIV screenings, and they can be handled directly at our health centers for established clients. We offer free preventative materials such as condoms, lube, dental dams, and brochures, which are all located at our health centers. There is a prevention services phone line that folks can call us directly with any prevention assistance questions that they may have. An important point at the bottom of the slide. This is the number for clients to call to make an appointment with our HIV prevention staff. Please make sure to encourage your clients to leave a message if nobody answers, and they will receive a call back within 2 business days at the latest, but usually much more quickly. Here's also the MPEP hotline, again at the bottom of the slide. Here are some resources for you to use and to share with clients to get educated on HIV and HIV prevention methods. First, HIV.gov shares all topics HIV, learning about the basics of HIV, HIV prevention, HIV treatment, and how people living with HIV can stay healthy. From there, you can find the Ending the Epidemic EHE plan and read up on how the mayor plans to lower HIV rates by 95% by 2030. HIVrisk.cdc.gov is a great website for an HIV risk reduction online toolkit. Next, the PhillyKeepOnLoving.com is a great resource for anyone who wants to learn about staying protected against HIV, but also seek services throughout the city of Philadelphia without leaving their homes. Folks can chat with someone online, find HIV prevention services, find a PrEP provider, or get condoms and lubes sent directly to their house. Our HIV prevention program is essential to eliminating the HIV virus, and we would love for you all to reach out to us with questions. Health Center 1 is separate from our city health centers, but is still a great resource for folks to get STI treatment for free and prevention services for folks who do not live in Philadelphia. City health centers and Health Center Number 1 work under different divisions, meaning city health centers provide ongoing care with healthcare providers for Philadelphia residents, while Health Center Number 1 supports folks who do not live in Philadelphia without ongoing care and follow-ups. The NPEP hotline could be a life-saving number for folks because the clock is ticking with NPEP, and we don't want patients to wait for our health centers to open if they need services after hours, during holidays, or during the weekend. All these tools will help us collectively do a better job at keeping our clients educated, protected, and safe. I would like to thank you all for your time and patience with this e-module. Hopefully you all learned something new, and hopefully you learned something to share as well with folks. Please feel free to call us with any questions regarding HIV, HIV prevention, HIV treatment, PrEP, NPEP, or just other general questions related to sexually transmitted infections. We would love to help everyone. Please have a good one.